So I'm really looking forward to hearing a lot of exciting new developments at this year's 40th CFS conference. There's a lot going on in the field, a lot to be updated on, including cellular therapies for hematologic malignancies and solid tumors, bispecific antibodies, which are having really, I think, a really important role in the management of hematologic malignancies, advances in immunotherapy in terms of the expanding role for immunotherapy in a variety of diseases, including triple-negative breast cancer, both locally advanced and metastatic. The evolving role of PARP inhibitors to treat patients in the adjuvant setting of early breast cancer, and also metastatic prostate cancer and other diseases. So I'm really looking forward to this year's, the 40th Chemotherapy Foundation Symposium. There's a lot going on in the field, a lot to keep up with, and a lot that we'll hear about from really some of the most foremost experts in the field. I don't really know where to begin, but I'll begin somewhere. We could start with, engineered CAR T-cell therapy for, of course, lymphoma, leukemia, and now an evolving role in multiple myeloma. Bispecific antibodies, which I think are having an important role in those diseases and lymphoma. BTK inhibitors really have, I think, changed the face of chronic lymphocytic leukemia and are having a role in lymphoma as well. The antibody drug conjugates are really striking level of activity in a variety of diseases, including hematologic malignancies, breast cancer, other cancers that I think are changing how we think about treating cancer. The use of PARP inhibitors. They now have, of course, a role in ovarian cancer and cancers associated with germline mutations in BRCA1 and 2 in the metastatic setting. But in addition to that, now have a proven role in prolonging disease-free survival and overall survival in patients with early-stage breast cancer who have germline BRCA mutations. Of course, targeted therapies as well in a variety of different tumor types targeting specific somatic alterations. And just a lot to hear about. Well, I think this year the story, at least thus far, has been on the role of antibody drug conjugates in the treatment of HER2-low metastatic breast cancer, where this therapeutic strategy has been shown to prolong progression-free survival and overall survival, and continuing, I think, advances in the indications for immunotherapy in diseases other than melanoma and non-small cell lung cancer. So I think these have been some of the major stories this year that we'll hear about.